I'm Dr. Tim Conway, and I've been involved in the treatment and research of dyslexia for the past 17 years. I'm a board member of Einstein Montessori School. To study the brain, scientists can use functional magnetic resonance imaging, or fMRI, and positron emission tomography, better known as PET scan. With these tools, we can label areas of the brain and isolate those specific areas that are weakened. This weakness, or interruption in the firing of neurons and synapses, slows down the learning process. While there are many myths about the causes of dyslexia, well-designed research studies reliably identify one primary cause as a weakness in phonological awareness. Phonological awareness has three components: the ability to separate a word to each individual sound, the ability to notice changes in the sounds of a word, and the ability to self-correct errors in reading without using contextual clues or visual memory. Phonological awareness deficiencies are neurologically based. Neuroscientists have found that the dyslexic person is impaired primarily in one or more of the language centers in the left hemisphere of the brain. Many scientists believe that children with dyslexia compensate by using different areas of their brain, and they are in many cases creative thinkers. These language centers are located in Broca's area of the brain, which is responsible for speech production. Wernicke's area is responsible for language comprehension. The angular gyrus converts printed letters or words to sounds. The supramarginal gyrus is used for phonological processing. The superior temporal gyrus handles general auditory input and perception. The prefrontal cortex is the auditory working memory, which is important for self-correcting errors in reading, spelling, and speech. All of these regions must work together well to enable the most efficient functioning of the brain. Although an exact location in the brain that causes reading difficulties has not been found, and there may not be one single location responsible, there is empirical evidence that the most common cause of reading problems is deficiency in phonological awareness. The good news is that even the most severely dyslexic child can achieve dramatic reading improvements. To accomplish this, we must keep moving forward in developing and using therapies to improve phonological awareness. Our research-based programs have attained high reading gains. The cornerstone of our methodology is the Linnemood Phoneme Sequencing Program for reading, spelling, and speech, also known as the LIPS program. Children who struggle with reading and spelling often lack the ability to perceive the identity, number, and order of sounds within words. These abilities are known as phonological awareness skills. The LIPS program improves phonological awareness skills and so increases reading and spelling accuracy. This program focuses on using visual, auditory, and oral motor feedback. This use of multiple senses is the most effective way we know to teach the sound and letter associations that are central to all alphabetic languages.